It's a topic your sisters are talking about. But when it comes to a common infection called the UTI, many students are a little fuzzy.
University of Tennessee? I don't know.
I don't know. Wait, hold on.
I have no idea.
Oh, is that an STD?
A UTI is a urinary tract infection caused by a bacteria that enters into the urinary tract. It can enter at the opening of the urinary tract, the urethra, which is a small tube that connects the bladder with the outside of the body. And it can travel up the urethra into the bladder and all the way up into the kidneys. It's very common, and it can occur more often in women than in men because of the anatomy of the women, where the urethra is very short. It's also a very uncomfortable infection. Women have this infection and they suffer miserably from the symptoms of the urinary tract infection.
In fact, more than half of you will get a UTI in your lifetime, and nearly 1 in 3 will have at least one by the age of 24. UTIs account for more than 8 million visits to healthcare professionals each year.
Sexual intercourse is the most common risk factor for urinary tract infections. And the reason for this is because of the friction that occurs during sexual intercourse allows the bacteria to enter into the bladder. And that's why there are certain sexual positions that put you at an increased risk of getting a urinary tract infection because of the increased friction involved. And for the same reason, sometimes after a period of abstinence, you may have more vigorous sex, and this again causes more friction and makes you at increased risk of a urinary tract infection. There are also some methods of birth control that increase your risk of UTI, and these include the diaphragm and/or spermicide. So if you're experiencing recurrent urinary tract infections and you're using a diaphragm or spermicide as your method of birth control, you should talk to your doctor about alternative methods so that you can decrease your risk of UTI. In addition, it's important to note that sexual intercourse is not the only way you can get a urinary tract infection. There are some women who are just more prone to UTIs than other women. And in spite of everything that they do, they're still going to get UTIs. So it's important to note that although sexual intercourse is the most common risk factor, you can get a UTI without having sex.
So how do you know you have one?
Ouch.
Burning, I guess. I don't know. Your back hurts really bad.
One of the more obvious signs is a frequent and urgent need to urinate. You may feel like you have to go to the bathroom much more than usual, but can't. Or when you do go, you're only passing a small amount. You may also have a strong burning sensation after you urinate. One symptom of a UTI that can be pretty scary is reddish urine caused by blood from the urinary tract. Keep in mind that UTIs should only cause a small amount of blood in the urine, but mixed with liquid, it can seem like a lot more. One less common symptom is a dull pain in your lower back, a sign your kidneys are inflamed.
If you have symptoms of a urinary tract infection, it's very important that you take care of it right away. The sooner you take care of the infection, the sooner you'll feel better.
Taking a drugstore remedy to relieve the symptoms can help in the short term, but in the long run, you're just masking the signs and not solving the problem. If you think you have a UTI, the first thing you should do, see your doctor or go to the student health center, because the only way to get rid of a UTI is to get treatment with an antibiotic. Remember that your doctor is the single best source of information regarding you and your health.
The most important thing when you're taking an antibiotic is to take the full course. So it's important to take the pill as it's prescribed. This is really easy with UTIs because it's one pill once a day for 3 days. It's easy and you get rid of the infection.
Recurrent UTIs are a problem for a lot of women. In fact, 20% of those who get a UTI will get one again, and your risk increases with each subsequent infection. 20% of women who have had one will have a second. 30% of women who have had 2 will have a third. 80% of women who have had 3 will have a fourth. So how can you help prevent the problem? Drink water. 8 to 10 glasses every day will help flush out bacteria in your urinary tract. Get up. Shortly after sex, get up and go to the bathroom. Urinating after intercourse will help get rid of bacteria in your bladder and urethra. Remember proper hygiene. After you go to the bathroom, wipe from front to back. This will help keep bacteria from getting into your urinary tract. Don't hold it in. If you have to go to the bathroom, go. Urinate at least every 4 to 6 hours throughout the day, and do not postpone or resist the urge to urinate. So you know what to look out for, what to do, and how to help prevent the problem. But there are other questions your sisters are asking.
Does cranberry juice really help a UTI?
Remember that the only real treatment for urinary tract infection is an antibiotic. Cranberry juice might help. The problem with cranberry juice is that in order to get the beneficial effect, you have to drink many glasses of cranberry juice. And cranberry juice is very high in calories. And so nobody really wants to drink the amount that they need to drink in order to get that effect. Now, cranberry also comes in tablets, but the problem with this is that I don't know which tablet to tell you to take or how many of them to tell you to take in order to get that beneficial effect. So when my patients ask me, I tell them that cranberry juice won't hurt them and it might help them, but I can't tell them any more than that.
Are UTIs and yeast infections caused by the same thing?
No, yeast infections are caused by a fungus, and you need an antifungal agent to treat your yeast infection. But sometimes you can get a yeast infection as a result of taking antibiotics for a prolonged period of time. Luckily, because UTIs are treated with just a 3-day short course, generally you won't get a yeast infection as a result of treatment from a UTI.
Is it possible to not have any symptoms at all?
It would be unusual to have a UTI and not have symptoms. Most women who experience urinary tract infection are quite uncomfortable. They present with urgency, frequency, and pain, and they know they have a urinary tract infection. So if you have no symptoms, the chances are that you don't have a urinary tract infection. Or if you do, it's such a mild infection that it's really of no significance.
Can you get a UTI from sharing a bathroom?
You can't catch a UTI from sharing a bathroom. A urinary tract infection is caused by bacteria, and the most common risk factor associated with UTI is sexual intercourse. There are other risk factors, but none of which include sharing a bathroom.
Why are some girls more prone to getting UTIs than others?
Some women are more prone to UTIs than others, and there's many theories as to why this is the case. Nobody really knows. But if you suffer from recurrent urinary tract infections, it's important that you see your doctor because there are ways to deal with these recurrent infections and help prevent them.
Can you get a UTI from using a scented tampon?
A scented tampon shouldn't cause a urinary tract infection. But I suggest that if you're using tampons, that you change them frequently for good hygiene. And also, if you have a choice between a scented and an unscented tampon, I would suggest that you use the unscented tampon because many of my patients experience allergic reactions to the scented variety.
So while there are letters we definitely want in our lives, UTI are 3 letters we don't. For more information on urinary tract infections, log on to www.allaboututi.com. Pillow Talk is an educational program developed for Kappa Alpha Theta and sponsored by Bayer Pharmaceuticals Corporation.